So, in our discussion about the proton pump inhibitors, we will cover topics including their mechanism of action, therapeutic uses, pharmacokinetics, and adverse effects. So, the proton pump inhibitors work by decreasing the acid secretion in the stomach by inhibiting the hydrogen potassium ATPase, which is also known as the proton pump in the parietal cells. And there is many steps for acid secretion. They start with eating a meal, which lead to the stretching of the stomach, which activate the stretch receptors, leading to gastrin secretion from the G cells, and the gastrin would go and work on the enterochromaffin cells, which secretes the histamine. And both of the histamine and the gastrin would come and work on the parietal cell, on the H2 receptors for the histamine, and for the G receptors for the gastrin. And this would lead to increase in the cyclic AMP, which activate protein kinases, which lead to the breakdown of the H2CO3 into an H and a bicarbonate, and the H would be secreted into the stomach lumen by the proton pump here to bind with the chloride to form the acid, which is the hydrochloric acid. And the proton pump inhibitors work to inhibit the last step, so they inhibit the proton pump to suppress the acid secretion. And since they inhibit the final step in acid secretion, they have the highest efficacy in suppressing the acid secretion compared to the other medications that suppress and neutralize the acid secretion. Now, the FDA-approved proton pump inhibitors include the omeprazole, the esomeprazole, the lansoprazole, the dexlansoprazole, the pantoprazole, and the rabeprazole for their therapeutic uses. So they are used as a first line for treatment of peptic ulcer disease and esophagitis and gastroesophageal reflux disease, and for prevention of non-steroid anti-inflammatory drugs induced peptic ulcer disease, and for treatment of Zollinger-Ellison syndrome, and in treatment of H. pylori triple drug therapy. Now, off-label uses of the proton pump inhibitors in patients on antiplatelet therapy before or after endoscopy procedure because of the high risk of bleeding in those patients. Now, because patients on antiplatelet therapy, they have high risk of bleeding, so if a minor injury occurred during the endoscopy procedure, this would lead to bleeding in those patients, and the acid would aggravate the bleeding. That is why suppressing the acid with the proton pump inhibitors is indicated in those patients. Now let's talk about the pharmacokinetics. So these medications are available as oral and intravenous formulations, and they are best administered 1 hour before food intake. That way they give the best results for acid suppression. Now, the proton pump inhibitors are prodrugs, and they are activated after undergoing an acid catalyzed cleavage in the acidic secretory canaliculi of the parietal cells in the stomach. And the PPIs are metabolized by the hepatic cytochrome P2C19 enzyme, and higher blood levels of these medications are expected in patients from Asian ethnicities and in elderly patients. Now let's talk about the adverse effects. So common adverse effects with these medications include headache, nausea, diarrhea, abdominal pain, fatigue, and dizziness. Infrequent adverse effects include rash, constipation, anxiety and depression, and myopathies. and rarely these medications may lead to hypomagnesemia. And in this case, when the patient is taking a proton pump inhibitor with hypomagnesemia, then the magnesium level cannot be replenished by supplementation, so the proton pump inhibitors has to be discontinued so the magnesium level go back to normal. Now the hypomagnesemia present as tetany, seizures, muscle weakness, delirium, and cardiac arrhythmias. Proton pump inhibitors may also lead to infection. That is because the acidic environment acts as a chemical barrier against bacterial infections. So once the proton pump inhibitors suppress the acid secretion, this will lead to suppression of the chemical barrier, and this would lead to increase the risk for Clostridium difficile infections and other enteric infections, and even community-acquired pneumonia. Now also, the proton pump inhibitors may lead to rebound acid secretion, and this is caused by the prolonged acid suppression by the proton pump inhibitors lead to increased levels of gastrin and histamine, which when the proton pump inhibitors are discontinued, they act to increase the acid secretion to levels higher than before initiation of proton pump inhibitor therapy. Now also, with the prolonged use of proton pump inhibitors, this may lead to vitamin B12 deficiency because the proton pump inhibitors interfere with the intrinsic factor secretion by the stomach, because the intrinsic factor needs acidic environment to be secreted, and the intrinsic factor is essential for vitamin B12 absorption. So once the intrinsic factor cannot be secreted, this means that the vitamin B12 cannot be absorbed, and this would lead to vitamin B12 deficiency. Now also, the iron, the calcium, the magnesium deficiencies are all due to the lack of acid, because the acid is important for breakdown of foods and release of micronutrients. Now finally, it is important to understand that on prolonged use of proton pump inhibitors, the magnesium level and the vitamin B12 level have to be monitored. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe.